This is my 3-year-old adopted daughter, Camille. I was originally her foster mom. She was born 2 months premature, and I brought her home when she was 6 days old. Camille was born addicted to crystal meth. Her mom was on drugs and also abused alcohol. Because of that, Camille has a hard time with eating, behavior, and sometimes her social skills.
I thought it maybe she was just allergic to milk. But then when we tried to feed her, she always gagged. She couldn't keep anything down.
I contacted her physician, but I also contacted her social worker. After that, he gave me a referral for her to go to the feeding clinic at California Pacific Medical Center.
We are the only multidisciplinary feeding clinic in Northern California for children who have both medical and developmental issues, and we will never turn a family away because of their inability to pay. And that's where philanthropy is absolutely essential.
I didn't know until today that the feeding clinic was funded by people giving money and their donations. The other children in her group, their families were more well off than I am, and they never treated her different. Here at the feeding clinic, they have helped me with trying to find out what type of foods that Camille likes. And they would also play games. If it was like a veggie stick, we may blow the little whistle. We had like a choo-choo train, choo-choo-choo-choo. So it was more like eating, but play with eating, to try to make it fun for her.
We worked with Mom, Grandma, and Camille over the last couple of years to the point where Camille is eating solid food. And our hope is that within the next session that we will have her off of the bottle and her intake of solid food will increase even more.
It makes me feel really good that she's now made a lot of progress, and it's just like she's a different child.
I think that if I had not received any help from the feeding clinic, that Camille may have passed on because she just wasn't eating and I didn't know what to do. Because of the donations of the individuals who have given money to the feeding clinic, it has made a better quality of life for my daughter.
In 2009, we had about 17,000 visits. At least 30% of those 17,000 visits were a result of the philanthropic dollars that are raised. Without that, we would not be able to serve everybody, and our vision and mission is to serve every child that can walk through this door.
I think that Camille has a very positive and bright future ahead of her. I'm looking forward to see her grow up. I think she will be a singer, maybe a singing chef.